Now we will go to Uganda, to Pamela Mawanda from Uganda Radio Network. Pamela, please unmute yourself and ask the question.
Hello?
Hello? Yes, we can hear you.
My question goes to Dr. Tedros. Following the emergency committee's sitting, what is your general advice to countries around the world in regards to how they should handle lockdowns, lifting of lockdowns, and the way forward to handling the virus?
Sorry, difficulty finding the right button. Yeah, no, this is a challenge that governments all around the world are facing right now. And as you know, governments have implemented different forms of public health and social measures, which many people know as lockdowns. So it's very difficult to give specific advice at a global level that is relevant to any individual country. What we clearly recognise is that public health and social measures have been effective in suppressing the intense transmission of the virus in many countries. And that's been achieved by different forms of lockdown in different countries. Exiting from there requires a very careful, well-planned process that's based on, number one, understanding the exact epidemiology of the disease in your country or at subnational level. So do you understand the problem? Do you understand where the virus is? On the basis of that, is the virus coming under control? Are you seeing a falling rate of infections? Do you have in place public health surveillance measures to identify, test, trace and isolate? Do communities have the necessary information to protect themselves, and do they have the necessary means to protect themselves through physical distancing, hand washing, etc.? And has the health service been strengthened to a point where it can treat all of the cases effectively and protect health workers with adequate PPE? So they're the types of considerations that countries need to make. Then obviously countries need to consider, in the process of opening up their societies and their economies, which measures to change or relax first, and how to measure the impact of those changes. And what we hope obviously to see is that the reproductive number or north of the epidemic in any individual country will not jump up because of easing of certain measures. So it's really important as countries ease those measures that they're constantly on the lookout for a jump in infections, and in particular are dealing with transmission in special settings. And we've seen this in many countries. In Europe and North America, we've seen the disease in long-term care facilities. In places like Singapore, the disease in dormitories for migrant workers. So what we need to be able to do is understand that even if the disease is under control in the general population, there may be vulnerable populations or contexts in which the disease can take off again, spread, cause death, and potentially transmit back into the general community. So what we are advising is that countries take this measured, stepwise approach to the process and be ready, if necessary, to put back in place some of those public health and social measures if needed, should the disease jump back up. I know that is not, we do recognise, and I think all governments recognise, the difficulty of maintaining lockdowns for social, psychological and economic reasons. This is not easy. And we also recognise that particularly in developing countries, where the immediate economic impacts on contract workers and those who work from day to day for their daily bread is even more profound. So we are very anxious that we can move to a situation where the disease can be kept under control with less severe measures, but at the same time we want to avoid a situation where we release measures too easily and then we bounce back into intense transmission and we have to do it all over again. These are very, very difficult judgments for governments to make, but they must be done carefully and with eyes wide open.
Thank you very much, Dr. Ryan. Hope this answers a question that came from Pamela from Uganda Network of Radios.